Parkinson's disease is a progressive neurological disorder that primarily affects movement. It results from the degeneration of dopamine producing neurons in the brain, particularly in an area called substantia nigra. This loss of dopamine leads to a range of motor and non motor symptoms that significantly impact daily life. The most recognizable symptoms include tremors, which often starts in the hands and fingers, rigidity or stiffness in limbs, and bradykinesia. Bradykinesia refers to slowness of movements. These symptoms can make everyday tasks challenging, affecting balance and coordination. As the disease progresses, individuals may also experience postural instability and difficulty with gait, leading to an increased risk of falls. In addition to motor symptoms, Parkinson's disease causes various non motor symptoms such as depression, anxiety, sleep disturbances, and cognitive changes. These aspects can be just as debilitating and are often overlooked in the discussions about the disease. The exact cause of Parkinson's disease is still not fully understood, but a combination of genetic and environmental factors is believed to play a role. Age is a significant factor, with most cases occurring in people above 60. While there is currently no cure for Parkinson's, several treatment options are available to manage symptoms. Medications like levodopa can help replenish dopamine levels, while physical therapy and occupational therapy can improve mobility and daily functioning. Sportive care, including counseling and support groups, is crucial for patients and caregivers to cope with emotional and practical challenges of the disease. Overall, Parkinson's disease presents complex challenges. However, the patient can lead a good life. The most common drug used to treat Parkinson's disease is levodopa. Other drugs include bromocriptine, ropinirole, pramipexole, flagyl, entacapone, tolcapone, amantadine, and many others like procyclidine and promethazine. Thank you very much.